गुड मॉर्निंग एवरीवन। आप सबको मेरा प्रणाम। वेलकम बैक टू अनदर एपिसोड ऑफ हेल्थ दरबार। आज हमारे साथ हैं डॉक्टर अंजलि, जो नी पेन और एक्शन पॉइंट्स के बारे में बात करेंगी। एंड आई एम श्योर हम सबको अपनी लाइफ में कभी ना कभी इस प्रॉब्लम का सामना करना पड़ा है, तो आई एम श्योर कि ये एपिसोड आज का आप सबके लिए बहुत हेल्पफुल होगा। बट उससे पहले आई रिक्वेस्ट आवर लिटिल पर्निका विद अस, ही इज हियर विद अस to start the day with a morning prayer. Parnika, over to you.
Namaste. Today I'm going to sing Saraswati Namastubhyam. Suklam Vishnum Sasivarnam Chakrapurjam Prasannavadanam Sarva Jayat Sarva Vignopasantaye Saraswati Namastubhyam Varade Kamarupani Vidyarambam Karishyami Siddhir Bhavatu Me Sada. Dhanyavad.
Thank you, Parnika. Thank you so much for starting our day on such a beautiful note. And thank you, Chalapati ji, for bringing Parnika to this platform. So, ma'am, can we start our topic?
Yes, Sonali. Okay. Good morning, everybody. Welcome to yet another episode of Health Darbar. And today's topic is very interesting. And I think everybody in their life has faced some kind of pains, especially with the knee pains. And the topic is knee pain and the action points. What are the critical areas when we really need to look after our knees a lot? So what is knee joint? Let's understand what is a knee joint. So knee joint is a hinge joint, just like a door, like it opens and closes. And it has 2 to 3 surfaces attached with the main bone. So the long bone, which we call as the femur, and attached to the bone in the shin bone, which is called as the tibia. And in between the shin bone and the tibia, another bone, which is called as the fibula. This is the whole complex of the knee format and a kneecap, which supports all the knee joints together. And in between these knees, we have something called as menisci, which are very cushion-like structures, which helps to make your joints glide into the movement areas, and few thread-like structures, which we call as ligaments. Ligaments hold the major complex of your knee bones together. तो क्या होता है, as you grow up as a child or as you grow up as an adult and into the old age, the majority of the weight, which is a weight bearing joint, it's a knee joint. हम सब समय जब खड़े रहते हैं, वॉकिंग करते हैं, सिटिंग टू स्टैंडिंग करते हैं, क्लाइंबिंग स्टेप्स करते हैं, स्क्वाटिंग ऑन द फ्लोर करते हैं, तो हमारा नी जॉइंट ज्यादातर यूज होता है. So the knee joint is the major joint which has to bear the forces of the body when you are sitting, when you're standing, when you're walking, when you're climbing steps. Now, if this joint is not taken care well, because of not sitting properly, not trying to walk properly, not wearing proper shoes, इस knee joint में काफी सारी problems आती रहती हैं. And ये सारी problem हमको आजकल बचपन से दिख रही हैं. So we are seeing young kids, young adults, young teens getting this knee issues. तो इसका मतलब ये नहीं है कि हम भागना छोड़ दें या walking छोड़ दें. So the key point क्या होता है, अगर हमारे knee joint में pain आ रहा है morning में, early morning उठते ही आ रहा है pain, there's a swelling on the knee joint, there is redness, there's like increased temperature on the skin surface of the knee joint. So we will have to understand that at younger age, it could be something called a juvenile arthritis. So that's an action point which we will have to consult our orthopedician, rheumatologist, and physiotherapist combination to understand what's going on with the knee joint. So juvenile arthritis, ज़्यादातर हम age group of young age group about 10 to 14 to 16 age के बच्चों में देखते हैं. उसमें knee joint काफी swelled up होता है, there's a lot of fluid accumulation in the knee joint, knee में उठना बैठना मुश्किल हो जाता है, movement restrict हो जाता है. And in the same criteria, we have inflammatory arthritis, जिसको हम rheumatoid arthritis भी बोलते हैं, which can be at a very young age. And the onset could be just gradual, कि सुबह सुबह उठे, they'll have bilateral. So generally हम rheumatoid में bilateral knee joint arthritis भी देखते हैं, where the knee joints have got swelled up, there's redness, there's increased temperature, and there's total loss of mobility. पूरा फंक्शन ऑफ द नी जॉइंट थोड़ा रिस्ट्रिक्ट होते रहता है. अर्ली मॉर्निंग स्टिफनेस इज द ग्राउंड रूल टू अंडरस्टैंड कि हाँ ये दिस इज समथिंग विच इज मोर लिंक्ड विद इन्फ्लेमेशन, नॉट लिंक्ड विद इंजरी. क्योंकि कभी कभी हम लोग को लगता है हम गलत सोए थे, तो मसल में कोई खिंचाव आ गया या लिगामेंट में खिंचाव आ गया, एंड दैट्स व्हाई दिस this ligament might have pulled the joint, and that's why early morning I'm not able to get up. So that's a rheumatoid arthritis where we do some blood marker testing like rheumatoid factors in ESR, वो सब elevated आएंगे इन सारे blood picture में अगर हम इन सारे arthritis देखेंगे. And in majority of the cases, जैसे persons are aging like 30, 35, 40, earlier I used to see osteoarthritis. What is osteoarthritis of the knee joint? जहाँ पे wear and tear of the knee cartilage हो रहा है as person ages. So generally, long time ago, I would see age group of 55 to 60 or 65 to 70. But nowadays, I'm seeing very early onset of osteoarthritis. Within 35 to 40 also, I am seeing, or between 30 to 35 also. Because blame it on our lifestyle, blame it on our, the kind of shoes we are wearing, the kind of postures we are maintaining. All that goes towards maintaining the health of the knee joint. Now, as we become like age, the joint cartilage also wear and tears, and that osteoarthritis also causes a lot of deformity. So sometimes कुछ लोगों का bow leg होता है. So as a child, अगर बच्चों को bow leg है, flat foot है, ये सारे criteria can affect our knee joint health. तो बचपन से अगर जिनके बच्चों के bones जो हम बोल रहे हैं tibia is kind of bent like a curve, it's called bow leg. बो लेग होने से क्या होता है, जो नी जॉइंट हमारा होता है वो नी कैप बाहर की तरफ मूव्ड हो जाता है, एंड इट कॉजेस वेरी टाइट मसल्स अराउंड द नी कैप, एंड व्हिच आल्सो कॉजेस लॉट ऑफ पेन, डिसेबिलिटी इन मूवमेंट, इन वॉकिंग, इन सिटिंग एंड स्क्वाटिंग. और एक और नी डिफॉर्मिटी हम देखते हैं विच इज कॉल्ड नॉक नी. जो हमारे जो नी कैप है, नी वो एकदम पास रहते हैं और हमारे एंकल दूर रहते हैं. तो ये नॉक नी भी हम बच्चों में काफी देखते हैं एज दे आर ग्रोइंग अप. एंड ये सारी चीजों को बचपन से ही वी शुड काइंड ऑफ rectify with the help of a physiotherapist and an orthopedic, and with exercises a lot of things can be corrected also, so that you get a good knee joint as you get older and as you age also. So this is the criteria जो हमारे knee health को decide करते हैं. So what are the key important pointers? Early morning, if you're not walking, you're not moving the joint, and you're continuously sitting in cross knee position, जो हम बोलते हैं ना Padmasana position, that also puts a lot of wear and tear in the knee joint sometimes. And also, as we are aging, we have stopped squatting on the floor. We have stopped the Indian squat, जो हम duck squat बोलते हैं. So जो knee का lubrication है वो भी धीरे धीरे कम होते जाता है. So always remember, for a good knee joint health, you got to add more movement, more loading of the joint. जितना आप load करोगे knee joint, जितना walking करोगे, जितने देर खड़े रह सकते हो, as you age, as a young kid, as a young adult, as a young teenage, आपका knee health बहुत अच्छा रहता है. So more movement will bring about more lubrication in our cartilage, in our kind of the whole complex of the knee joint. अब यंग एज से जो हम देखते हैं काफी सारी इंजरीज जो देखते हैं नी जॉइंट में, वो होती है नी जॉइंट लिगामेंट इंजरीज. सो फुटबॉलर्स, क्रिकेट प्लेयर्स जो भी कॉन्टैक्ट स्पोर्ट्स खेलते हैं, तो ज्यादातर क्या होता है, ये इंजरीज को हम बोलते हैं शियर स्ट्रेस इंजरीज जो बोलते हैं, या कॉन्टैक्ट स्ट्रेस इंजरीज और वैल्गस स्ट्रेस इंजरीज पे, जहाँ पे क्या होता है एक पैर ट्विस्ट हो जाता है एंड द पर्सन फॉल्स and hits the hard surface on the ground. उस कारण से we see a majority of the injuries in the footballers, basketball players. तो उसमें क्या होता है, जो मेन लिगामेंट हमारा जो फीमर और टीबिया को स्टेबलाइज करके रखता है, चलने में हेल्प करता है, that is called the anterior cruciate ligament or the ACL. That gets sometimes torn or tear or rupture. उसके torn or tear होने से you will hear a sound called pop sometimes, majority of the times, and people will get lot of pain around the knee swells up and the person is not able to bear weight. So ये थोड़े action points और emergency points होते हैं जहाँ पे immediately you would have to seek an emergency physician's help. to see what is gone with the ring, wrong with the knee, and get your knee sorted out immediately with rest. Basically, the principle is rest, icing, elevation, and trying to do some compression bandage or a knee brace. By resting the knee, you will bring the inflammation which is caused because of ligament tear to come down, any kind of blood oozing out because the tear of the ligament has happened. It causes a lot of exudate, a lot of kind of leakage of inflammation around the knee. That would also come down. But elevation is the main criteria. 2-3 पिलो रख के आप leg को elevate करके रखो तो उससे जो fluid accumulate हो रहा है knee में वो भी reduce हो जाता है. So knee ligament injuries can be multiple, like which could be ACL, could be PCL, which is the ligament right at the back of the knee, and the corners, the collateral ligaments, which is the knee joint के sides में जो ligament होते हैं, एक होते हैं medial collateral और एक होता है lateral collateral. ये सारे ligaments हमारे knee joint को बहुत stability देते हैं. कोई ना कोई एक ligament अगर गया तो knee joint becomes very wobbly and is not stabilized onto the tibia well. And in those scenarios क्या होता है कि जब भी person हम लोग को मिलता है तो बोलता है कि I was walking and I feel I fall down. I don't have a stable base of support. I feel like I can just twist and fall. So एक डर बैठ जाता है कि मैं कब गिर जाऊंगा. In most cases of ligament injuries. तो इस तरीके से action points criteria में हम आते हैं. Which are the most important worrisome knee pains are your rheumatoid arthritis because वो बहुत stiff कर देता है अपने joint को, mobility को भी कम कर देता है. Osteoarthritis we can prevent if we try to prevent a structural anatomical well-being. जैसे हम बैठ रहे हैं, हम टेढ़ा होके बैठ रहे हैं, पैर को क्रॉस करके बैठ रहे हैं, we are always sitting on one side of the hip. Majority of the times, men folks usually keep a wallet at the back pocket. उस कारण से उनका posture twist हो जाता है, टेढ़ा हो जाता है. So you will see osteoarthritis cases में एक knee joint में ज़्यादा pain आ रहा है कल के other के. So it's all structural anomalies where we bear more weight on right leg or bear more weight on the left leg. So in सारे कारण से we see that the joint structure is also getting affected. Common एक और एक knee pain हम देखते हैं is all the knee cap or the patella. So patella sometimes क्या होता है बहुत stiff हो जाता है and gets stuck onto the bone of a bone. And उसके कारण से we see a lot of chondromalacia patella. लोगों ने ये word सुने होंगे. So it's a lot of wear and tear of the patella tendon. Patella tendon में tendonitis आ जाती है. Sometimes the quadriceps जो main muscle of the thigh होती है वो patella पे जहाँ insert होती है वहाँ पे inflammation हो जाता है तो उस कारण से भी knee pain हो रहा है. And majority of the times we see a patellofemoral syndrome, which is a common pain which we see in postpartum. जो women deliver करके just like after a month or 2 months, they start complaining of patellofemoral syndromes. So patella is always at a wrong position onto the bone. वो friction के कारण it causes pain and immobility and person को लगता है कि knee jam हो गया है. Mainly in cases of women because they put on so much weight around the hip joint that puts a lot of Q angle strain on the patella. So बहुत सारे exercises for different forms of knee pain के लिए बहुत different forms of physiotherapy होती है. And I could say like in case apart from the inflammatory arthritis, majority of the knee pains can be sorted with good physiotherapy advice and with good action points in the sense like resting, icing, elevation, bracing. These are very key important points. Also to maintain your knee health, your calcium and your vitamin D is the most vital important nutrition you should keep in mind. And always remember, the more you are seated, the more you are sedentary, it causes no more knee pain issues. And जितना ज़्यादा आप walking कर सकते हो, जितना ज़्यादा अपने को mobile रख सकते हो, so the knee joint lubrication is also good. And majority of the times people have a bad habit of standing on one side of the body. So even if women are standing in the kitchen, एक side में weight डाल के खड़ी हो रही हैं, or you're going and teaching, or you're a student or you're a teacher, you stand on one side of the leg. All that in majority of the times will have effect or spiraling effect as you grow older. So in all these scenarios, आपको ये ध्यान रखना है कि आप ज़्यादा देर अपने knee को उस form में stress ना दें, जिससे आपका knee का जो alignment है वो change हो जा रहा है because you're standing on one side of the body. So these are the key points. I'll just kind of wrap up. And the key points is to keep your knee health good. Knee pain can be sorted out with good physiotherapy modalities and good advice. And to keep your knee joint healthy, remember that more muscle mass you should build up is on your thigh muscle, the quadricep, the hamstring, and your hip muscles, which is your glute muscle. And in case of any injuries which you have had because of sports and all, definitely seek emergency help and get your knee sorted there and then. Because if you kind of prolong it, you don't know whether it's a ligament injury or if there's a bony fracture. So you got to isolate what it is and then take adequate action. Thank you, everyone, and I'm open for questions.
Thank you so much, Dr. Anjali. We have a few questions. Achla Arora ji ka question hai, I'm having RA factor positive and knee joint pain since 4 years. And now with knee, my calf and backbone is also paining. I am 46-year-old, no medication till, unable to walk sometimes.
So, so Archana ji, you have to keep your exercise very, very cautiously going for your knee joint mobility to be maintained. So, agar aapka knee joint mein arthritis hai, so there's inflammation. So first criteria is to decrease the inflammation and add in a little bit of muscle strengthening, which we call as isometric exercises to keep your knee joint, like the quadricep muscle, the hamstring muscles, and your calf muscles and your glute muscles to become strong. Because आपका अगर जैसे जैसे mobility कम होगी तो वैसे वैसे it affects other joints of the body, which could be your hip joint, can be your lower back pain, anything and everything will start, cropping up if you're not keeping your knee functional. So it's important that first thing you start doing is to exercise on the bed. Don't have to go and standing and exercising like squatting and all, but try to keep a towel and, do those quadricep presses, which say you can increase into 50 into 150 reps in a day, you can start doing. So the more amount of muscle mass you keep, the joint is able to load well when you walk, because the joint is already getting disrupted because of the rheumatoid. So the key mark point is good lifestyle, decrease your weight. You can do water-based exercise. So swimming pool mein jaake go for a walk, or you just kind of pedal in the water. So for rheumatoid, water therapy, or what we say hydrotherapy, is very, very good. So you can do that, and you can also do non-weight bearing cycling, like peddler or something like that. Thank you.
Thank you, ma'am. The next question is,
I see.
Yeah, what is, if there is a choice between the Indian or the Western toilet, which one should we prefer?
Yeah, so I am a very big promoter of the Indian toilet methods from the very young age. Okay, so 10 years down the line, if you ask me what advice I would give to the patients, I would say, please don't use an Indian toilet, use a Western commode, because it will cause knee pain. But now our scenarios have changed, because at a young age also, as a child, as a teen, everybody should try to use an Indian toilet, because आपका knee joint जितना fold होगा उतना lubrication और cartilage की health maintain होती है. So from the right young age, do not try to make the child or any teen just use the Western commode. The Indian commode is very beneficial to keep your back good, to keep your knee joint going till 60 and 70 without developing any arthritis. And as you get older also, I know when you have got osteoarthritis, called bend the knee flexion is restricted. So in those cases, knee Western commode is important. But why person ends up to that level is because they've stopped using the Indian commode. So Indian commode systems work good and should be promoted for prevention of osteoarthritis in the long term. Thank you.
I agree with that, ma'am. Harshara Kothari ji says, does back pain can be a reason for stiffness in the knee?
Back pain, yes. So sometimes we say that when you go to the doctor say, "Acha knee pain hai, to knee ka X-ray karenge." But like for us, like physios and all, we see that one picture is not says the complete picture of the whole body. So आपका back pain से ही knee pain आ रहा होगा. So sometimes your hip joint, your back spine might be twisted, and that causes a spiraling effect on, the weight bearing joints, which is your knee joint. So it's important that we find the root of the problem, which is your back, and then correct the back, and then your knee joint just vanish. Yeah.
Ma'am, what are the 5 rules to keep knee healthy? 5.
Pardon, I didn't get the question.
Ma'am, what are the 5 basic rules to keep our knees healthy?
So movement is the first thing. Movement is lotion for the body. So the more you move, your knee joint health will be good, and your cartilage strength will improve, lubrication will improve, lot of good hydration. So many of the time people look घंटों AC में बैठ रहे हैं लेकिन पानी नहीं पीते हैं. And your muscles around the knee joint gets very stiff and tight, and that is the reason many people, like players, footballers and all, they end up with ligament sprains and injuries. Thirdly, good footwear. So jitni women heels पहनती हैं, very high heels, that puts a lot of load on the kneecap for a woman. And those people who are wearing very ill-fitting shoes, जो आप shoes अच्छे से fit नहीं हो रहे हैं, तो उससे आपका क्या dynamics of the foot changes. And if the foot dynamics changes, that will affect your knee joint. And fifthly, but very important, is your good intake of calcium, vitamin D, good amount of protein, so that your muscle health is good and your bony structures are good. Yeah.
Ma'am, we have one question from Shivani ji. Shivani ji, are you there?
Yeah, thank you, Sonali ji. Dr. Anjali, I wanted to know about that ACL tear. When we get this ACL tear, is basically a sports injury. Is it? That's what I got to know. There was a ACL tear in the family, and till the time the inflammation is there, you can't go for the surgery. So if you don't get the surgery done, then what is the what are the outcomes of it?
Shivani, so ACL, जैसे ही सुनते हैं कि ACL टूट गया है, right? When we feel that the ACL has gone, there are several grades of ACL tear. So it could be grade 1, grade 2, grade 3. And sometimes MRI is not just a true picture of how the person's ACL is. We will have to see the functional movements of the person and the patient, how he's functionally, what's his age, what's his patient is, what his demands are with respect to physical activity. So ACL definitely needs a surgery. Physiotherapy, we are able to get back patients on the ground to play football without a surgery. So the long time ago, only thing we would say is, okay, ACL is gone, let's do a surgery. But new concept now. The new concept is to get the patient to develop his muscles and develop his proprioceptions. And a lot of times we are able to reverse the whole damage. And a person is a sports person, is a young guy and a person, then definitely we would need a surgical intervention. But if somebody is sedentary, doesn't have to play sports, just working on a lot of core building exercises, I think ACL surgeries are not mandatory at all. And we have sports persons who have returned back to sports even with complete 3-degree tears. But as I said, there's different degrees of patients, and we have to evaluate. Each person is very different, and accordingly we can, suggest.
Okay, because long term, what we had seen, then if the surgery didn't take place, the person was limping, and after the surgery, he was able to walk well.
Okay, but after the surgery, was he able to get good physiotherapy? Because what's important
is I think 8 to 12 weeks, it was recommended very good physiotherapy. Without that, it would have not taken. But it had to be taken very good care on that.
Yeah, you have to take minimum 9 months if you are a sports person and wants to return back to playing sports. So, because once you've done an ACL surgery, the brain definitely doesn't set signal to the knee to move as it should move. And that's the reason why we always keep saying, if you're getting an ACL surgery, please get a good physiotherapy done, good rehab done. And that should be minimum 6 to 8 to 7 to 9 months if you want to return back to sports. because फिर क्या होता है, movement restrictions होते हैं, लगते हैं, and a person's body gets a lot of deformity because of not getting a good physio post ACL.
Okay. Thank you, Dr. Anjali,
Yeah.
for your time.
Dr. Anjali, I just have a small personal question. That somebody has been diagnosed with arthritis already, and sometimes, you know, the thing is that you do fermentation, hot fermentation, it gives you relief. So should we do hot fermentation or cold fermentation?
So if suppose there's a rheumatoid arthritis, do you know what arthritis the person has, whether rheumatoid or osteo?
I guess it's rheumatoid, ma'am.
Rheumatoid, yeah. So if it's already very much inflamed, right? So there's already a lot of inflammation and swelling in major cases of rheumatoid. So you will not do a very, very hot fermentation or something because it causes more swelling in the joint. So sometimes it's advisable just do a hot and a cold, a contrast, a hot and a cold and a hot and a cold like that, because it'll help to get the muscles become freer and at the same time take away the swelling also. And yeah, that's the thing. Yeah.
Thank you so much, ma'am. There is a appreciation message also that the topic is very informative and they look forward for many more sessions from you. So thank you so much, Dr. Anjali, for joining us and giving us such valuable information. Thank you so much. Thank you everyone for joining in.